this dialogue approach means to you with regard to your experience with the COVID crisis and the creation of COVAS committee. Thank you very much. And yes, I am privileged to be the president of COVAS. This is a scientific committee following on from the COVID scientific committee, COST, and the vaccination strategy in France. As you know, COVAS has a much wider scope than the previous committee. It targets all health risks, whether supposed or real, at all scales in relation to animal, One Health, and global health. These risks are not just risks of infection, even though infection is one of our main topics. It's also risks associated with food, changing environments, or climate change. So its missions are incredibly vast, and the legislator intended there to be 16 members within this committee, consisting of doctors, scientists, and vets, with animal health specialists and also representatives of civil society, representatives of associations and citizens' bodies. This isn't new. I come from the HIV community, research community, and this was perhaps the first pandemic that was really grasped by civil society. And in France, and perhaps across the entire world, this built the concept of health democracy and the real and tangible need that we have to implement dialogue, constructive dialogue at that, between doctors, scientists on one hand, and also patients and civil society on the other hand. This is extremely important. In my career, I've worked a lot on vaccinations with the consortium of vaccination research at a time when vaccination was very important in France. This was after a pandemic, a bird flu pandemic in France, and vaccination was a major issue in terms of research. And I've really been submerged in this important relationship between the different patients and doctors, for instance. This is important in the fight against human disease. And I don't, however, know if as much importance is given currently within the veterinary sciences. We have COVAX, which was working on the monkeypox vaccination and COVID. We're working currently on bird flu, dengue fever in mainland France and overseas. This is particularly important for vector-borne infectious disease. We work with patient associations, but also largely with society. The fight against these illnesses needs us to work with society. This is perhaps slightly long what I'm saying, but this notion of interaction with society and the medical, scientific, and veterinary communities is really important. The example of HIV showed us that we can build very positive research approaches, care approaches. There's a word that we have in English, which is empowerment. And it's very important when talking about HIV, for instance. Society needs to be empowered to tackle health issues alongside scientists and the medical community. Thank you very much, Ms. Autran. I'm now going to move on to Emmanuel Soubeyran, who works with the French Ministry of Food and Agriculture. As a representative of public authorities, what is your vision of this dialogue, particularly for crisis management? And we'll perhaps be able to hear the explanation of this difference between scientific assessment and risk management. Could you perhaps give us an example from bird flu, which we're talking a lot about at the moment? Thank you very much, Jean-Luc. I think, all of us here, this dialogue between science, society, and policy is essential. And as a manager, I'm representing the Ministry of Agriculture in France, but the decisions that we make are based on scientific opinion. This is very important. This dialogue is necessary. But we also need to be able to explain this. In this word society, I believe that there are two types of actors. There's the stakeholders, those who have something to do. In the animal sector, we have livestock herders, and we need to be onboarding these actors. Otherwise, the strategy, the policy that we're deciding on may not be understood and may be poorly implemented. And then there's the general public. We need to explain to the general public what we're doing. They're not directly affected in that they do not need to implement anything, but on the other hand, they can choose to adhere or not adhere to a policy that we're implementing. This dialogue is vital during crisis and peacetime. So if we look at the current crisis that we're having at the Ministry of Agriculture, we've implemented a crisis unit for bird flu with a number of different missions: support for decentralized authorities, participation missions, data collection missions, communication missions as well. And all of these missions require dialogue with scientists, providing data on the health situation so that they can give their opinion on changes to the strategy with partners so that we can explain what we are implementing, and also with the general public. They can see the mass slaughter of animals. I'm talking about vaccination. If we do not explain what we are trying to do, they can sometimes be concerned or worried about that. So in crisis, it is essential, but even in peacetime, in my experience, it is more difficult, paradoxically, to communicate during peacetime rather than in crisis time, because the topics are not always easy. It's not always easy to convince journalists of the importance of a topic when everything seems to be going well. So, crisis can be an opportunity for us to communicate messages. The bird flu is especially interesting. We in are faced with a disease that is impacting poultry at the moment, but there is a large zoonotic risk, even though we have not seen this yet. There may be some cases that are alarming, but we need to be especially vigilant. Managing this case shows how much we need to work together within an approach, a One Health approach, with our colleagues from the Ministry of the Environment, working in French with the French Office for Biodiversity, with colleagues from the Ministry of the Environment, and also colleagues from the Ministry of Health with the French Public Health Services, in order to provide this monitoring, which is very important for livestock farming, but also for populations, particularly within people working or in direct contact with these animals. In peacetime, as I said, it's a little bit more complicated, but some tools do exist. There are consultation bodies in food and health, animal health sectors. There are a large number of institutional stakeholders who have been working on citizen participation with a certain number of opinions that have been generated using this new participation technique. I would also like to mention the health environment, One Health approach, and its committee that includes a number of stakeholders around the table in order to discuss this issue. As Professor Autran was saying earlier, these issues are very wide-reaching and need to be properly understood by all parties. Uh, Jean-Luc, I haven't answered your question about the separation between assessment and risk management. I do think this is important, however, because we do need dialogue between everybody, but we need to make sure that everybody's roles are clear. People involved in assessment are carrying out scientific assessment and issuing scientific opinion. The government and the various ministries, on the basis of these assessments and perhaps other information, whether economic or scientific, they're making decisions. And what's important is transparency in the decisions that are made and the policy that is implemented. There is a lot of mistrust. We've mentioned this already, but this should help everybody to understand these issues. So that separation is very important as long as it is accompanied by transparency. That's everything I wanted to say. Thank you very much, Emmanuel. I'm now going to hand over to Mr. Serge Bresse, who is a doctor and also a director of an NGO, Saltis. And we're going to ask you what vision you have of this dialogue and what are the challenges of dialogue with civil society. Thank you very much. Thank you to PREZODE for inviting me to take part in this event. I am here because dialogue is at the heart of our action at Saltis and the impact that we want to have in our project. So I'm going to present what we do very quickly, and then talk about One Health approaches and the prevention of zoonotic risks. Our NGO is 20 years old, created by doctors working in West Africa on all health issues, particularly in infectious and emerging diseases. We've worked on Ebola and on COVID with an approach that's quite modern. We have a non-substitution approach. We're trying to work with local partners and use our projects to produce knowledge and identify effective projects working with citizens and policymakers, which we call advocacy traditionally, for the adoption of successful initiatives, both in terms of policy and initiatives. So we are facilitators of dialogue. One Health's not at the heart of our project. We were working originally on HIV and now on infectious disease. We've understood how important it is to have that link between animal health and human health. So let me say a little bit about what we do. I will be lucky to present a more specific approach later on, but we promote dialogue with local actors. So we are working with agriculture, livestock farmers, vets, the local authorities, and also, above all, the populations, the citizens living in the areas in which we intervene. So the first thing that we can offer is time and resources for this dialogue to exist. Everybody is very busy. We're working in countries, and it's the same in France. Everybody is focused, 100% focused on their own activity. And we need to be looking up and looking at what's happening around us. Before the crisis, this wasn't very common. It's very difficult. As well as with these local actors, we have very local projects. And we also work with national and international institutions. As an NGO, it's very interesting due to the geographical areas that we work in and very decentralized projects that we work in. It's interesting for us to be able to share these messages about what is working and trying to scale those up. In order to pass from theory to practice, we have more robust research programs. So we work with Cirad and AFD in order to operationalize this concept, which is still a little bit undefined, with very concrete work on One Health and the prevention of zoonoses. We've been thinking a lot about patient-centered work, and this is a challenge in our dialogue. You were talking, Brigitte, about empowerment. We need to be building capacity to act. That's really what empowerment is. And this is linked to policy making and knowledge of research. It's not very easy, believe me. All of this work on the prevention of emerging zoonoses needs to be within a global and overall health approach. If we've got a mum living in a Paris suburb or in West Africa, they're not going to be preventing zoonoses when they're coming to collect medicine. It's quite complex to implement this. That's what we're trying to do. A message that we want to communicate through One Health and the prevention of zoonosis is that we need to be thinking permanently, more widely, broadly about the impacts of climate change. So if I go to an African village, for instance, we're talking about the prevention of respiratory diseases or mosquito-borne diseases, for instance. This One Health approach leads to can lead to an increase in identifying some of these zoonotic diseases. This dialogue is not easy between academics and policymakers. We're fortunate to be able to work with operations and theory in order to break down the borders here. We live in a world where people do not have time to think more broadly, and we're trying to create synergies to enable this. Thank you very much, Mr. Brace. We will be coming back to interactions with the different levels and the local level, particularly earlier. We were talking earlier about communication with the media, which is very important. The media are actors and vectors of this dialogue. I'm now going to hand over to Florence Pinault, who is a journalist at the La Tribune newspaper, so that you can give your analysis of the situation and the role that the media should or should not be playing in crisis time or peacetime. As we heard earlier, it is important to inform populations. Thank you very much. Thank you very much, and thank you very much to PREZODE for organizing this meeting, because I do believe that One Health is not communicated sufficiently in the media, and it's very interesting. As we said, communicating around health risks and zoonoses in crisis period and in peace periods is very different. You may have noticed that in the past a year, we've been talking a lot about arms and the lack of munitions rather than wearing masks. As the latest variants of SARS-2 are quite terrifying in terms of the health impacts, but the public are less interested in things that are less burning. As journalists, we look at what the population are most affected by. That's what makes the headlines. It needs to be in their neighborhoods, in their country, okay, in Europe maybe, but beyond that, the number of kilometers and the number of deaths is a rule that shows journalists that the further away it is, the more deaths you need. So 20,000 deaths in Africa or Far Asia is difficult to communicate on. The earthquake in Turkey isn't that far away. It's just by Europe. We started with around 20,000. It's gone up. So we've been able to get traction on that topic. It's maybe horrible for me to say this, but we're in an age where readers and viewers are just saturated with information, especially with internet and continuous information flows such as BFM and other channels where there's news constantly. There's no longer sport or culture. Our business model is to capture audiences and to keep them there. Otherwise, we do not have enough money to pay our journalists. So there's a dictatorship from the audience numbers. And in order to increase our audience numbers, when there's a health crisis, it works because people are mobilized, people need to know. At the start, we were delighted for the scientific committee to have been appointed because finally we felt like policy makers were listening to scientists and we could talk about science to the general public. There was this effort to be teaching. We didn't need to spend as much work communicating this, but it worked around 2 or 3 months, but we still didn't have a vaccine. And the population got bored. So outside of times of crisis, it's difficult. That might be sad to say, but it's difficult. With internet now, there's informative marketing. This is ads for news where they add colors and try to brighten up the news, add a few surprises. And as journalists working behind the scenes, we're used to writing something that's then proofread. And we'd have spent about a week working on something. And now we're asked to promote new topics every 2 days in order to retain audience attention. And the information is not keeping up with the marketing, which is a shame. And science could not give us new information on SARS-CoV-2, a new protein, it's fragile, we need to attack it like this or that. We had a general public that was used to understanding differences between bacteria, but we had to give them more information about COVID. And the informative marketing raised a lot of issues here. If there is too much information, we need to adapt. The way that people listen is different. I'm sure you've noticed how children listen. They need stimulation. They need to be encouraged to click on news stories. There's more marketing approach. So science was not giving us enough. And we saw in civil society the emergence of new trends. At the start, they understood the messages and the risk. We saw people emerging who wanted to talk. There were a lot of them that started to talk utter nonsense, saying, I read this, I saw this, there won't be a vaccination. The vaccination is going to leave a particle that's going to be recognized by 5G, and the government will be able to track us. I've heard some absolutely crazy narratives, less so in the written press, more on the internet. The written press is a little bit less quick. We do have to verify our facts, otherwise we have legal issues, particularly for the editor-in-chief. So we saw the appearance of people who were interviewed and were spouting nonsense. We could say, yes, we should listen to them. The editor-in-chief might say everybody wants to listen to them, so we should give them some airtime. But then those messages were being communicated. It may seem silly, but we always heard Professor Raoult. I I wanted to say we've understood 5, 10 times what he wants to say. Let's stop. We don't know some other people who were speaking, and it could have been interesting to hear from those people. We had this virus of the dictatorship of audience numbers, like I said, which made us, pushed us towards giving them airtime. And we saw that their was a lot of information being communicated from people who we continue to give airtime to. And then there were chroniqueurs, people writing um, feature pieces. This is debate writing in order to generate audience numbers. There are plenty on the radio. Columnists, for instance, and they'll say, some people say this, but I say the opposite. So columnists or commentators, these are not journalists, but they're the ones generating audience numbers. And we need to be able to identify that commentators or columnists are not journalists. Think about the rule of proximity. It's not the number of deaths per kilometers, but you do need to be touching, you need to be impacting readers. It can be dangerous, interesting, moving, and this is going to interest neighbors, friends. There needs to be this proximity to our ego in order to generate revenue. We need to have something that will be empowering them or affecting them in some way. Thank you very much.
Mais il y a des pistes, il y a des pistes quand même d'information correcte du citoyen. On a vu aussi tout à l'heure qu'il y avait la nécessité pour qu'il y ait
We
un
can
bon...
say that this is not easy, but there's some ways we can use good journalistic practices and build trust between different players and put in place important mechanisms. So now I'm going to hand over to Mathieu Le Gris, who is responsible for agriculture, rural development and biodiversity within the French development agency AFD, and I'm going to ask him to tell us what's his vision of this dialogue from an AFD perspective, how he sees this dialogue being funded, because obviously there are questions of money behind all of this. Thank you very much, Jean-Luc. Good morning, everybody. My point of view is going to be someone who works within development and international solidarity, and I'm going to talk a little bit about how the science-society policy dialogue works in the One Health approach within international development. So we look at the way this dialogue happens and in some cases facilitate it. So one of the things for this dialogue to work well, and one of the obstacles, is the question of time and timelines. The fact that in times of crisis we're able to talk about things that relate to potential crises. It's a lot easier right now to get politicians talking about responding to food crises that are current rather than future health crises. And we have to think about how to invest in order to reduce the costs of future crises, because that's the key issue. It's not just about getting them taken into account in policy, but it's about investing in order to avoid future costs. And I think there's some clear figures about what science can do, showing that this is a worthwhile, profitable investment, but it is a difficult investment to make. That applies to the prevention of zoonotic pandemics, but it's also relevant to issues such as biodiversity. So that's the first issue. The second aspect from my point of view is how you manage to bring together the complexity of scientific analysis and discourse around some of these societal issues, and on the other hand, the necessary visibility and clarity of policy action, which requires a more simple and direct discourse. I think it's an eternal challenge, and researchers know this better than I do. You have to talk to politicians and get politicians talking about very complex multi-factor issues. And in this light, I think that the efforts need to be made to simplify the discourse without losing the scientific rigor, and that's pretty tricky actually. And so I believe that coalitions between research and civil society, which focus often on advocacy, are key partnerships. This requires researchers to take a step in terms of simplifying their approach, but the advocacy organizations need to ensure that they are not caricaturing the approach. I think it's particularly true for One Health approaches. The other point is the intersectorial, cross-sectorial approach. You can put in place committees and commissions and different bodies to get people talking together, but in reality, in order to get a public policy impact, what we observe in southern hemisphere countries, particularly in Africa, is that the institutions and authorities are very sector specific, and they have to accept surrendering part of their prerogatives and part of their power in order to take part in cross-sectoral initiatives. You don't just have people who want to do it because of their own goodwill. You need a strong political lead, a sense of conviction with respect to high-level political leadership in terms of breaking down the silos and the walls between different sectors. So that goes back to my previous point. My final point, and I hope I've not been too long in what I'm saying, in order to go back to what Serge was saying, I would say that in order to convince people, you need to give some very strong evidence from the field. The One Health approach is very interesting from a conceptual point of view, but it's difficult to understand sometimes in concrete terms what it means. So we need to be able to give very clear and concrete, embodied demonstrations in the field about what it means. So working with a community of farmers, for example, in order to identify the way in which their practices and their interactions with their ecosystems can have an impact on their own health. That can be identified on a local level, on a territorial level, and it takes time. It requires local consultation. And that's the kind of thing that we're trying to fund within the AFD in order to promote the One Health approach, because when we are able to demonstrate that it can be worked out in concrete actions, that can be fed into the dialogue in order to raise awareness on a policy level. Thank you very much, Mathieu, for all of this. We're going to hand over to civil society now, with all of the people who are here in the room and those who are online on YouTube. So let's ask questions to our panelists in order to show that there is a real dialogue with civil society on these issues. Just Brigitte Autran, who's got a little comment. Yes, indeed, I'd like to come back to what's just been said, and in particular, the role of the press. I think that the media can be very useful in undoing some of the fact-checking some of the fake news that's out there. And what I wanted to say was, in relation to what Mr. Legris said, is that politicians need scientists. Policy needs science, not only just to support decisions and take reasonable, sensible decisions, but in addition, and COVAS is an illustration of this, policy needs science in order to communicate with the general public. And so I think that's what we're trying to do within my organization, within COVAS. Luckily, the legislator has asked us to issue our opinions in a very public and transparent way, but we try very much to communicate them to the medias and help journalists to understand what we're saying. We try to write in very much layperson's language, and we try to communicate things through our work with the media. I think there's an important interaction here. It's not saying that we have the word of God or something like that, but when we communicate as co-VARs and we talk about looking ahead and anticipating One Health issues, we try to explain to the general public what the scientific concepts are. Obviously, we need to ensure that policy isn't both based solely on journalism. We can see the fragility of the journalistic model, which is very economically and financially driven, but it's important to educate the general public to scientific realities. So I think this three-way dialogue between policy, science, and the media can enable us to convince people or have a voice within society, and I think that's very important. Thank you very much, Mrs. Autran. Do you want to say something? Yes, I wanted to respond because there was a study last week who showed us that young people are less and less interested in science. There has been a drop of 5% in interest over the last 30 years, and only 16% of 11 to 24-year-olds 16% of 11 to 24-year-olds don't believe that the Earth is round. A large proportion also think that the Americans didn't send men on the moon because the flag wasn't waving. And they think that because the flag wasn't waving, it was a fake photo. So when we talked about science as to editors in chiefs, I can do it. I write in some young people's publications, and my editor-in-chief has understood a number of things in terms of science, but it's okay, but it doesn't go that far because the general public don't want to feel like they're at school, so we have to almost turn it into a form of entertainment, a bit like in an editorial. When I say entertainment, I don't mean that we're changing facts. My advice to One Health is to think about how you present the information, how things happen in the field, what are the challenges in everyday people have to face, why do people have to go into the bush to find their meat, so if they're struggling to find food, even in Europe, I think readers can understand that people might be hungry and might need to head out into the bush to find their food. So telling a story, using examples, using these techniques which are very present in all forms of media, the way that information and news is wrapped and presented in storytelling. So we are still being asked to create audiences. If I write something that no one reads, why is that any good? Why is it interesting to me, apart from saying thank you to the people I've interviewed? So this presentation, storytelling around the news, getting people's stories and testimonies, and then trying to cascade from cause to effect. You need to cascade down to the reader themselves, to the very doorstep. This rule of proximity, it needs to say to the reader or the listener, this could happen to you on your very doorstep. Yes, thank you very much. Within PREZODE, we've got some good examples of that, some good examples of how things are happening in the field, because PREZODE is based on local initiatives. So we've got some really good examples that can be used for the general public. I think there have been a number of questions on the chat, so I think I'm going to read some of them out. 2 questions so far. The first was, why are there not conferences for consultants and advisors? That's sorry, why is there not an ecology approach within One Health? We have a place for an ecologist. Unfortunately, there are only 16 places on our committee. There's a slight majority of doctors. There's also vets. There are scientists, and one of the scientists is an ecologist. There's also an we have a strong ecological approach. We've got a specialist in environmental epidemiology as well. So the scientific committee has 16 places, and there wasn't space for any more ecologists. We are planning to get a seminar going on the theme. We don't all have enough of a scientific background in order to understand the role that climate change and environmental change will have on human health. So we're very aware of ecology and the need for it. Another question, which is probably for Mathieu here. The One Health approach is a new approach in many African countries. How can the AFD support the media in order to help people learn about this approach? Thank you very much. Thank you for this question. I think that the first element is to take an illustrative approach, the kind of storytelling we were talking about. But how do we work with the media? It's actually a new area of work for our organisation, the AFD, but that is starting to grow in importance because one way or another, the initiatives focusing on dialogue between science and policy are becoming a strategic priority for the French Development Agency. There were some things that we didn't used to do. We didn't used to work with associations of journalists, for example, and it's becoming a bit more of a priority. I'm very pleased about this. It's a bit of a new initiative, so we are kind of learning as we go, but it is something that we are able to do now. We can support organizations, particularly groups of journalists, in helping them with this type of approach. The forms that this takes may vary. We have realized, however, that it's a major issue and we're going to need to move forward and make some more progress in this area. Thank you very much. There's an additional question in the room. Mr. Espes, would you like to go ahead? Yes, I've got perhaps a fairly general question for the panel. I haven't got any statistics, but I remember Vladimir Suchek, who was head of the scientific arm of the European Commission, who said 70% of published results are not reproducible. This lack of trust in science comes from the fact that there are a lot of scientific articles which are rather weak or could even be wrong. A recent example I know of is the article in Nature on the consumption of antibiotics within livestock farming. It was an article written in bad faith and based on incorrect statistics. I think it's really important today that we have committed as scientists, people who are committed to discussion when you have issues like this. I guess this is more of a comment than a question, but I think it's an important issue to highlight. Thank you very much for that. Mr. Bress. Yes, a brief response to this. In the past, I've worked a lot about issues around advocacy. We do have an issue with this because we want to work in an evidence-based approach, but the difficulty is there's different timelines between science and policy. And so the difficulty we have in terms of pesticides is that demonstrating impact takes a long-term study, whereas policy needs to be taken immediately, and the citizens are at the heart of that. We try to do that is to bring citizens into this decision-making with a sense of conviction. We can't only work on scientific evidence, we need to work on the conviction of the scientist, the operator, and also on citizens' conviction. So we need to highlight the real challenge, the difficulty of bringing citizens to make immediate decisions about long-term issues. So I think within One Health and other areas, it's an issue that we come across quite often. Well, I think we can wrap up this first part and thank our 5 panelists. So we'll hear from them a bit later again because we're going to have a final episode right at the end. I'm going to invite the next 5 speakers to join us on stage. We've got 3 on stage and 2 who are online. So Mr. Bress is going to be staying with us. You can swap chairs if you'd like to. In the second part of this talk, we're going to talk about international issues and the importance of dialogue on a worldwide scale. And the first question I'm going to ask is to Magda Robalo, who is the former Minister of Health for Guinea-Bissau and President of the Institute for Global Health and Development. Madame Robalo, to what extent is this type of dialogue essential? Can you talk about the issues with respect to the place of women and local communities in health issues, but also of the key role that you've been able to play as a political leader on this issue?
Yes, I can hear you. I hope that you can hear me. Thank you very much. Good morning, everybody. The dialogue between society, science, and policy is not just essential, it is a priority. If we want to move forward in a One Health approach, we have just finished the most severe part of the COVID-19 pandemic, where we observed a large deficit of knowledge, credibility between policymakers, social actors, and scientists. And this has had a major impact on how we were able to manage the pandemic. We were not listening to each other, which had huge consequences in being able to provide a timely and adequate response. In peace times, we need to be focusing more on building this dialogue and building trust. We should be building communication bridges that will be like a savings account that we will be able to use during times of crisis. There will be other crises. There are crises ongoing at the moment. And we need to be regaining trust and credibility. That's very important. I think that restoring trust is founded on 3 pillars: the convergence of public health, this community of policymakers, scientists, and society requires open dialogue, of consultation and co-construction in order to build a new world order for public health. Some practices and concepts will be promoted within this, along with other measures. So, for example, countries, developing countries at risk, the fact that developing countries are more at risk is something that it's a myth that we need to bust. Developed countries are often very difficult to manage in terms of health risks. We need a new framework for collaboration and coordination. You were talking about the role of women. As you know, women are the majority of health professionals. They're often on the front line in their communities, in the most far-flung places. And they provide healthcare to the most vulnerable populations that need it the most. So women provide healthcare in the home, to their families, to their husband, to their children. They also are more likely to provide healthcare to their communities. They have the trust of the population. The risk of an epidemic turning into a pandemic is universal. It's everywhere. All pandemics start with an epidemic within a community, at the community level. So the importance of the role of women, even if they are not healthcare professionals, in the home, they're providing healthcare to their families. And they're important actors when looking at this chain of monitoring in order to identify the risks and the start of an epidemic. It is important for them to be involved from the offset, as they will help promote dialogue and action. Dialogue can only be successful if there is the participation and involvement of women and the local community, through those that are able to mobilize and persuade them to get involved. We were talking earlier about this term empowerment. It is important to ensure the full empowerment of women within their local communities through information, the communication of risks, by using the most appropriate language possible and integrated action frameworks, human health, animal health, and environmental health. This is not optional. This is the route we need to take. I was listening earlier to the journalist. I apologize, I've forgotten her name. And the information about obesity. And this has its positives and its negatives. And we need to be working on communication channels and using the most appropriate language for communities through women, so that the message can reach people that need it the most and who sometimes struggle to differentiate between all of the many sources of information that they are receiving. Let me wrap up by saying that as a policy manager, I've traveled to the most remote areas in my country to work with associations of women and leaders, religious groups, in order to communicate information, to listen to them, and to use discussions with them to better define policy. This allowed us to reach the most remote populations where women played a very important role. We know that feminine leadership in health is a problem. Only 27% of women hold leadership positions, even though they represent 70% of staff in the healthcare field. We still have a lot of work to do. And we need everybody's support in order to achieve this. I hope I've not spoken too long. I will stop there. Thank you very much. Thank you very much. That was excellent. We'll be coming back to some of the points later. International organizations have a major role to play in dialogue and the implementation of this dialogue. I'm going to hand over to Jean-Philippe Dopp now, who is Deputy Director General of the World Organization for Animal Health, the WOAH. And he will be able to be talking about coordination with other international organizations. So how is work internationally carried out able to influence the local levels as well? Thank you very much for inviting me to this roundtable on on dialogue. Feminine leadership does exist. My organization is led by a woman. The WOAH has around 80 member countries, including France. I will be talking about the fact that viruses and diseases do not have borders. This means that international cooperation should not have borders in this area. We saw with COVID, with the bird flu, with other types of disease, that it is extremely important. And this is why we've implemented this quadripart alliance between WHO, FAO, the World Organization for Animal Health, and UNEP, the United Nations Environment Programme. Some panelists have mentioned the important role of the environment in the spread and emergence of disease. This is a fact that we need to take into account in order to communicate the increasing importance of this through climate change interfaces with ecosystems. You also talked about governance, risk management. I would like to say that we also need to have global management within One Health through the positions that we hold in an international treaty on pandemics in the future. This week, there's an important meeting in Geneva, and there's a first draft of this planned treaty, international treaty. And the Quad Party is insisting, as other panelists have said, that we need to have a special term, PPR, prevention, preparedness, and response. The first P needs to be a capital letter. We need to be working upstream, far upstream, the emergence of risks. And I think that that is the main purpose of PREZODE, to identify what we call drivers to prevent spillover. This is a key message that we're hoping to communicate within the quadripartite. Looking now at governance and capacity building, looking at health services in Africa, for instance, we need to help the countries that need it most. We need to invest in health systems in plural. We often talk about workforce in the singular, for instance, but medical services, health services include vet services. They include environmental staff who will be supporting us to detect emerging phenomena. One Health needs to be operational. I remember a visit that I had in Senegal for an assessment of veterinary services. We went to a Senegalese river, the Saint Louis, and it was environmental staff who welcomed us and showed how they identified cases of bird flu in wild animals. And this could be a forerunner, a sign of the spread of bird flu. If we are building capacity in laboratories, this is what we did in a project in Central Africa, working with Cirad, IRD. This is a project funded by the European Union. After capacity building in these laboratories for PCR tests to detect viruses, COVID arrived, and then these laboratories were able to detect SARS-CoV-2. These were excellent examples of the One Health approach in practice. Practice can be as simple as the fact that the head of the veterinary services has the direct number to the chief medical officer. I hope that it's the case for Emmanuel. And on the other hand, the chief medical officer needs to have a direct number to contact the Emmanuel, for instance. This can be very simple, very practical things. And there's also large treaties being negotiated by the WHO at international level. We are seeking to build links between policy, science, and operational side. What we're trying to do, what you're trying to do nationally, we're trying to do internationally. Let me cite an initiative in France and Germany represented here today with the creation of a One Health panel. This is a little bit like the COVAS, but internationally, the COVAS. There's a group of 26 international experts that started this work a couple of years ago. There was a strong political drive from France and Germany initially. This has led to operationalization, which is led by the quadripartite. They have now given a holistic definition of One Health, which has been communicated. They're currently working on the definition of prevention, upstream prevention, which will be very useful in negotiating the treaty. To conclude, I would like to say there's no global prosperity without strong cooperation. There's no strong health service without a strong One Health service. Thank you very much, Jean-Philippe. We can see that the majority of health policy in human, animal, and environmental health are carried out with top-down approaches, and that the local is not sufficiently taken into account. So we're going to be talking about the role of local areas. I'm going to come to Serge Bress now. I don't need to introduce him again, but let's talk about the constraints that can exist and what role the local communities can have and how that can be a response to act within dialogue in order to propose concrete solutions. Let me illustrate this by an initiative in Senegal. There's not much of a time difference. So we were working in the Kolda region with 170 villages. This is on the border with Gambia. There's a lot of population movement, and we know the role that that has in the spread of epidemics. There's also agricultural and pastoral activities, chemical activities. There's very little regulation. There's a lot of chemical fertilizers. There's a lot of issues generated by the lack of regulation in these fertilizers. These are products of dubious quality. AFD has funded a project, and we were working with a number of different partners, such as Veterans Without Borders. You were talking about policy at all levels. In Senegal, there is a high council for One Health, and they work alongside the One Health committee. So there's dialogue between local, global, national. This project was, as I was saying earlier, to create conditions for dialogue between local actors in order to find contextualized responses to these large principles that we're talking about, and then to be able to translate that. Earlier, we were talking about One Health. It's about communication and strengthening the action of each person in their field with a more overarching vision. So with the support of our donors, we provide the resources and space needed for these discussions to take place. This is necessary, but it's difficult to get a healthcare provider out of their healthcare sector in order to attend a workshop where they're going to be talking about some practices, etc. The aim at the end of this is to identify common practices and to find simple local solutions that are practical that we'll be able to implement, working with all of the different actors. What's interesting in what we had in our approach is that there were two main topics around chemical fertilizers, pesticides. As I said earlier, there was a complexity of pesticide use in the area, and also the use of medicine for animals or humans, particularly micro antibiotics with antibacterial resistance that's growing. We were carrying out studies. We were talking about the links between policy, science, and society, so providing data on microbial resistance. The first results of this project over 3 years showed us that our problem at the moment is about sanitation, access to water, sharing of water resources, sanitation between humans and animals. So we were looking at quite overarching issues that were very important. Before going back to very contextualized local challenges, this feeds into what we were saying in the previous panel discussion, is that we are going to struggle to tackle more complex issues if we do not tackle these everyday issues, which are at the basis of everything else. You know the role of water and sanitation in spread of disease. I'm going to stop there. What we still need to do in this project is identify a number of actions. We want to have people communicating between themselves and also to communicate more broadly outside of this with contextualized approaches where we implement what we found within projects, the solutions that work, instead of trying to attach pre-identified solutions within this zone. Thank you very much. We can see that this is at local, national and international levels. At the same time, I'm going to be going over to Pierre Comte now, who is at the French Development Agency, the AFD, working as an assistant director in the health department. So what is your view of dialogue and also funding? We'll be talking about this later, especially with World Bank. Thank you.
Thank you very much for inviting me. Thank you for this question as well. Within the AFD, as Mathieu was saying, we've been working on this issue for a number of years now. We have been working on one of these key challenges, which is the issue about operationalizing things. There have been a number of key work strands for us in this area, and on a very prosaic level, it's focused on things like the interdependence of different sustainable development goals. And we understood the challenges and the difficulties that could be there, and the gaps in the approach focusing on development goals. So we've been trying to focus on cross-sectorial and intersectorial approaches to development. But as a funding agency, what does that look like in the field? There are various different registers within which we can end up working. There's a policy-focused aspect around the structure of financing, and in a very concrete level, we've been working with our German colleagues on European initiatives, the TD Europe initiative that you might have heard about, and we're working together on how European funding can be a actual European funding policy in order to promote and fund One Health projects. So we drew up a charter or a set of guidelines, about 10 basic principles that need to guide the European funding initiatives. It's just an example that I'm giving you, but these guidelines include some fairly simple things, simple to express, that need to be put down as a policy guideline. We talk about the multi-sectoral nature of the programs funded, commitment to rights, commitment to communities, focus on climate, commitment to institutional strengthening. You can read it. I won't tell you all of the aspects and the goals of it, but we drew up a kind of a roadmap in order to go alongside our funding dialogue. And if you drill down a little bit more on a geographical level, the second work strand was to strengthen regional organizations, because we said we need to decentralize some of our decision making. We need to work with regional organizations, and particularly focusing on what Beatrice said, the fact there's no borders for disease. We need to make sure that dialogue also has no borders, and we thought that regional organizations were a good place to focus on that. So our second focus is to support regional organization. In my case, I work with organizations like CDC Africa or other similar organizations. The third aspect is to use our fairly unique role. We have a bit of a specific role between the different stakeholders. We are able to dialogue with ministries, with public authorities, but also with intermediary bodies or even communities, because the projects that we have experiences of often are with ministries or other bodies. So we want to feed into this dialogue and seize the opportunity in order to connect the scientific organizations. We support scientific bodies, not just for research's sake, but particularly in applied research. But we are seeing that there isn't always a really distinct border between those types of research. We need to be able to support research and scientific activity, but we also need to be able to draw on community organizations and also draw politicians into these discussions. So in some ways, we're a bit lucky within our public policy approach, because we have a fairly prosaic approach. We get people around the table, and as Serge was saying, we focus on ensuring that we can bring people together who wouldn't usually meet together, even if it's just for a short meeting. We also focus on including a One Health approach in some of our projects. We're aware that some of our activities are a bit partial, they're a bit agriculture focused, veterinary focused, or so on, but because they were thought up within a One Health context, they might, as we go along, generate some outcomes and results that would be useful, and that might be able to build other links, because once again, One Health projects are a bit of an experiment. You have to build them, shape them, test them out. And just to wrap up, I'd like to remind you of a fairly fundamental point. It's not something that I heard very clearly so far today. It's that the decisions that need to be taken are pretty difficult. They will need to lead us to a very different, a radical new stance, very different to what it is today, and it might lead to some contradictory objectives. Currently, in France, the environmental ministry is bringing together prefects to talk about issues of water. The things that need to be done have been documented scientifically for quite a long time, but we're dealing with issues of conflict and contradiction on a local level. As Serge was saying, questions of who would get access to water, whether it's livestock farmers, health centres, or other parts of the community. These are not things that are very easy. So there's a real desire to build a policy dialogue, and I think One Health has been great in providing a vocabulary for setting up this type of dialogue. It's less about the consent, but it's more about the method, the fact of bringing this policy agora, this policy dialogue together, and it needs to be local or regional, and it needs to be very clearly cross-sectoral, community, policy, science, and so on. I'm sorry, I've overrun a little bit there. We're going to carry on talking about finance with Frank Berth, who is online with us. He's a senior expert on livestock farming within World Health, and he's also part of the World Community for Livestock Farming. Can you tell us whether this issue of dialogue is one of the priorities of the World Fund for Preparation, Prevention and Fighting Pandemics that's been recently launched, and how can you ensure this dialogue over time? Thank you very much, Jean-Luc. Thank you for the invitation. Thank you for asking me this question. Perhaps the first thing I'd like to say is to remind everyone why the World Bank is focusing on this One Health issue and this dialogue. I would like to remind you that health security is a development issue above all, and very specifically within the One Health concepts, the World Bank, because it is a multi-sectoral and multi-regional agency, is quite legitimate and has a fairly long history in the area. So the bank is very active on a policy level, on analysis level, but also on an operational level. I just want to give you a few figures about that. Currently, our investment portfolio within the World Bank includes 45 projects that could be referred to as One Health projects, cross-sectoral projects that are built on the principles of improving health security outcomes, and these projects represent around $1.5 billion of investment. We should also note that the bank's commitment is very strong in this area. In the current funding cycle, the poorest countries within the International Development Association, the IDA, there is a commitment on the part of the bank's trustees to support countries with One Health projects through the IDA. So we're seeing the way that the institution is engaged and the way this One Health concept is institutionalized, which for the World Bank is built on the various forms of experience, built on the initial bird flu experience in the mid-2000s, then on the post-Ebola experiences in West Africa. The fund that you're talking about, this pandemic combating fund, is one of the bank's commitments because it's come about as part of the G20 discussions under the Italian and Indonesian presidencies. This was when the fund was designed and established. So to come back to the question of the day about the Science-Society-Policy dialogue, I think this fund is actually an interesting example. It illustrates a desire to change our approach. And I'd like to give a few examples of this. In terms of the fund, the governance body has 20 seats. Within this committee, there is equality between the funding countries, those who pay into the fund, and the co-investor countries. Those are the countries who have low or medium income levels and who are going to benefit from the fund on as priorities. And there is genuine parity between these two groups of countries within the steering body. There are also 2 seats on this body for civil society organizations. So this council itself forms a dialogue and decision-making forum, because it is the decision-making body of the fund, and that's how we try to organize this dialogue. One of the points that was raised in the first segment of today's session is the concern to separate the assessment of this management issue, as separate assessment from management. And so in this, with this aim in mind, we have a scientific expert panel which works separately from our main council. We have 21 experts who sit on this panel. Their role is to help give scientific guidance to the fund in its investment priorities. Their role as well is to help us to assess various different funding proposals that will be put forward. So from a governance perspective, we try to organize this dialogue in order to ensure that the voice of civil society can be present and can be heard. We also try to ensure that science is able to say what it needs to say, and this enables us to organize the dialogue process. There's another point I wanted to present here, which is our call for tenders process. This dialogue involves the governance bodies, but we've just recently launched the first funding cycle drawing on this fund. The fund itself has around $1.6 billion, and the first cycle will represent $300 million. It will be focused on monitoring different laboratories and on their human resources. So there are 3 priorities for which the One Health initiative is very present. We've just closed the first window for calls of expression of interest, which will help us to help bidders to work on their proposals. I want to give you 2 examples which seem quite interesting. The first is the fact that in the way we work, countries are able to take charge of the proposals that are relevant to them. We're not asking the big organizations that are going to come in and help you to implement the proposals, the WHO, the FAO, the multilateral development banks. We're not asking them to draw up the projects. We are really asking the countries to design their own projects. We made reference earlier to the regional bodies, and we are similarly putting a strong emphasis on these regional bodies to ensure that we have very strong national projects which are very aware of the local and national context, but also, since these pathogens don't have any borders, we want to work in multi-country regional settings. The final point about these calls for tenders, which are going to come out, we have an important point, which is around co-creation and consultation of national partners in preparing projects, particularly for the implementation phase. We focus particularly on NGOs and civil society organizations in this light. And in this very operational phase of the funds, one of our key concerns is to ensure that the work is very much bottom-up, initiated by the grassroots. We focus on our One Health approach and want to ensure that the society is at the very heart of the initiatives, with very strong presence of science alongside all of that. Thank you very much for that question, Jean-Luc. Thank you very much. Let's now hand over to the audience, both those who are present with us and those who are online. So a first comment or response, would you like to introduce yourself? Yes, good morning. My name is Xavier Pavard. I work for the European Commission in the DG that's responsible for international partnerships, and I am working for One Health with a number of colleagues who are here on the panel. I'd like to just confirm what's been said, in particular by Jean-Philippe and by Pierre Kempf, and say that now we're seeing a bit of substance and meaning being added into One Health. Up till now, it was something that was fairly difficult to get hold of. It was a little bit confused, and I understand now that the focus is on really putting some meaning behind One Health. And I think the interesting thing is that there's an increasing coordination of the governance with the formation of the quadripartite, and a number of things that are being put in place in France, in Germany, and other EU member states. And I can see that we've talked about some common working, the Team Europe initiatives, which bring together the European Union and member states. And in the particular case of One Health, it seems particularly important to have the European Union involved, as well as the AFD and the GIZ, to work on One Health issues. So we get involved, we try and coordinate things alongside other funding bodies like the World Bank in order to ensure that the effects are maximized. I just want to speak up and say that the European Union is supporting all of this action. Thank you very much for this very important European perspective. Madame Autran, I think you wanted to respond. Thank you very much. Yes, I just wanted to come back to this internationalized approach to surveillance, and I was delighted to hear that the World Bank is starting a call for tenders. I think it's really important to have a world organization for monitoring animal fauna and human pathologies for all of these pathogens which would risk causing a pandemic. We're in the early days, but I don't think things are yet in their ideal state of coordinated monitoring. I think it's very important. One of the key subjects that COVAS is going to advocate on is to ensure that we put in place effective international human and animal monitoring, both for wild animals and for livestock. I think it's very important. The COVID crisis showed it, and the bird flu crisis is demonstrating it yet again. We need to really move forward in this light. France in particular. I'm delighted that Germany is also here, but France, within its own particular territory, needs to carry out this work alongside international organizations. I think that's vital. Thank you very much. If I could just add a brief comment as well, I very much agree with what you've just said, and we are trying to work in this way. In very concrete terms, the AFD is funding 3 projects in 3 distinctive geographic area, the Indian Ocean, the Pacific, and we've also got a body called the Caribbean Initiative for Public Health in order to consolidate this. The initial aspect was on human health, but we've drawn in animal health as well into these initiatives. We're not working on a worldwide level yet, but we are working on developing those networks, and we're particularly focusing on the Indo-Pacific region, so we're working with Southeast Asia on that.
Yes, thank you. I am a doctor, and zoonoses cause pandemics, which then I'm a nephrologist, and these pandemics can then feed into other epidemics. And this was well before COVID. My question is that One Health is a great philosophy to have, but will One Health give us what we need to act on the field, particularly the financial resources required to carry out actions, educational actions, more specifically? As a nephrologist, I have just validated a program. Recently, I became aware of this One Health philosophy, and I now believe that we cannot build anything or co-build anything without integrating this One Health philosophy. You say that you have a One Health program. Will we be able to draw on this philosophy of One Health in order to implement effective solutions within the population? Thank you very much for your story. Jean-Philippe, would you like to respond? Yes, I'd like to talk about the global monitoring question that Professor Bertrand was talking about. I have 2 observations. There are systems in animal health, so animal health monitoring systems that exist, and the WHO has systems in place. The importance is to interconnect these systems. And this requires political willpower, operationalization. We're back to this again, and a little bit of science, because data needs to be comparable. Data needs to be able to be analyzed. As a large project launched by WHO in Berlin, back in Germany again, the intelligence hub on pandemics and epidemics. We need to be paying close attention to that. The second message that we're talking about is transparency. There's only valid data if the countries want to be totally transparent right from the start. If we look at Wuhan, for instance, this is an example of countries that hesitate to communicate and take time to communicate. The earlier we are able to communicate, the better it is for the international community and the more data they're able to have on the emergence of these diseases. So interoperability and transparency are very important. Talking about funding, this is a sort of cool. You're saying we need to have civil society at the heart of our responses, but that means that we need funding mechanisms. I'm not talking about Soltis here. I'm talking about the location of any support as well. We need to be funding actions that are on the front line. And the second thing that I wanted to say, and I really want to reaffirm this is that there's no response to pandemic, non-transmissible diseases without strengthening systems. And these systems need to be able to manage all of these different challenges. We need to have laboratories for diagnosis on non-transmissible or epidemic illnesses. People on the front line need to be able to receive patients. We need to improve our alert systems, and this needs very local funding that is directed to civil society actors such as doctors and vets. This issue of funding, I think that Frank Berthe had something to say. Yes, thank you very much. I would like to go back to what Serge Bress said a moment ago, and the question that the lady asked in the audience. I do not believe that there's this disconnect between the global health security and healthcare systems. We have very vertical approaches, perhaps even segmented approaches to these different issues. And I think that what we're starting to do at World Bank and in this fund that I was talking about is to realign all of these different aspects. The aim is to ensure that health security is achieved through building up systems, capacity building for field workers, for people working on the front line. As Jean-Philippe was saying, this can be for tuberculosis, but also for universal health cover. We need to be working on aligning all of these things. And I think that the message has been clear. We need to ensure the involvement of actors in the field, in community work. And a final aspect which was mentioned was about communication. This was a real lesson that we learned from bird flu back in 2005, 2006. This launched a large program at the World Bank. These aspects have already been learnt in the assistance package that we provide to member countries as part of our COVID-19 response program. There's an effect of learning here. And I believe that we're moving in the right direction. Thank you. Thank you very much, Franck. I do not know if there are any questions in the chat box. I think that we've already gone over time in any case, so we're going to wrap up our second session now. I would like to thank all of the panelists from the first and second panel discussions. I'm going to ask for all of the first panelists to come back on stage as well, as we're going to ask each speaker to give one key message. And this is also true for those of you joining us online. Thank you very much, says Magda. I would like to come back to the importance of environmental management. I think that zoonoses are increasingly frequent because our environmental management is not adequate. This is part of prevention. Whilst acting with humans and animals, we need to protect our environment increasingly, and this is part of prevention. Thank you. Thank you very much, Ms. Robalo. Frank Berthe in Washington now. Thank you very much. Perhaps we could come back to the importance of funding. Our colleague Xavier Patin mentioned this. saying that we have a kind of intellectual nebulous on the concept of One Health, and we're now in the operationalization phase. I'm delighted to see that things are starting to come into being through funding. I think the last thing that I would like to say is that this requires international help, but it also requires the mobilization of all of us, of all of the countries. We all need to play our role and make sure that we are good neighbors to each other in order to prevent putting others at risk. This can be through mobilizing national resources and also through compliance measures with standards, particularly standards developed by the WHO and international health regulations, alongside standards for animal health as well. So there's a real need for collective responsibility as well as individual responsibility. Thank you very much, Franck. Thank you very much. I would like to wrap up by talking about awareness raising and training. This has been said on numerous occasions, but I find the image quite important. We need to break down the silos between the countries. We need to have a global approach capable of working in a cross-disciplinary manner. This is true at all levels. We've talked at a political level with ministries, and we need to do this. And it's not necessarily easy in everyday practice, but it's also true for research, for surveillance and monitoring. And it is also true for training and expertise in order to have a high quality dialogue between scientists and policymakers and between policymakers and society. We need to have people around the table who are informed, and awareness raising and training is therefore very important. I'm going to give you a bit of a teaser now. We're organizing an event, the agriculture show in Paris, in presence of the Ministry of Agriculture, Mr. Fenou, and the ministry delegated to prevention and the environment. We will be presenting initiatives to train decision makers of the future and also those making decisions today. There will be training that will include trainers from veterinary public health and also environmental health. And I think that this is very important. We'll be presenting a very interesting initiative on the theme of the fresco of climate, the fresco of One Health, in order to help us understand these different challenges. Thank you very much, Emmanuel. Florence, if you can be quick, just to keep to time. I'm going to say something very quickly. I remember talking to a scientist once talking about microbes, and I asked if you were going to be talking about an ancestor that I'd never even heard of. I thought that was very interesting. We are all derived. We all come from a common ancestor. I think that this is very interesting. Our species is just an animal among many others. We're continuing to evolve and develop. We are reaching a threshold, a point where things are starting to unravel. What I'm trying to say through this is that we don't have a choice. And if we are unable to challenge our opulence and comfort, our freedom to do whatever we want, to have lots of money, I'm talking about the West. If we are unable to call that into question, we're not going to succeed. I learned that scorpions would be able to withstand a nuclear war, for instance, and I think that we are the species most exposed at the moment. So thank you very much for all of your discussions today. That would be a great title for the newspaper. I love One Health. I also love One Health, and I'm glad that this is part of the COVAS forum. I would like to wrap up by talking about interconnection. It's interesting when we talk about silos and breaking down silos. We need human and veterinary health to work together, particularly on prevention. I think within COVAS, prevention is very important, and this can bring together human and veterinary medicine. Let's look at the example of the development of vaccination against bird flu. We had advocacy for ministers and other authorities in order to connect research, development, assessment of these vaccinations in order to have a sort of cross-fertilization within that. We cannot continue working in our own silos. This is a new era. We need to work in prevention, which is the only way of limiting the costs of these infections. Prevention, once again, cannot just be at a national level. We're lucky in France that our country is represented on all of the continents, but we cannot just work together between ourselves. We need to work at an international level. Thank you very much, Ms. Bertrand. We should be innovative, propose projects, and let's move forward together in order to keep finding interesting conclusions. Let me conclude first by saying that I agree with everything that has been said. We need the means to act and the means for dialogue, and this is going to allow us to provide solutions to the current crises. Thank you very much, Jean-Philippe Dob. It's always easier to speak last. I would just like to say that prevention is a capital P with the capital I for international, and this needs to be without borders. Everything starts with science and everything finishes with civil society. And there's just a bit of risk management and a bit of policy between the two of those. So in One Health, we need strong political commitment in the long term, so that One Health is not just a nice intellectual principle, which I think is increasingly well understood, but we need to make it operational on the field. We need to have contact details shared between animal and human health managers. We need networks between people working in human health, human medicine, and animal health. It's a lot about human relationships when we're talking about One Health. Let's learn to get to know each other and work together on an international scale. Thank you very much. It's all about trust, and this trust is only built through dialogue. I think that today's event is a great example of dialogue between science and policy. Thank you very much to all of our panelists who have been here today. Thank you very much to our speakers here in person on stage and those joining us remotely. Thank you very much, Marisa Père, who was responsible for organizing this session. Thank you very much to all of the teams at Cirad, the general director of Cirad, who's present here today, INRAE and ERD as well, who are here today. Thank you very much for listening, and I wish you all an excellent event here. Thank you.